So we're joined today by Dr. Deirdre Waterman, who also just happens to be the mayor of the city of Pontiac in Michigan. Welcome.
Thank you. Glad to be here with you and glad to greet my colleagues from the Ophthalmology Times.
You are really in a rather unique situation, having run a successful ophthalmology business or practice for nearly 30 years before running for office. Could you tell us a little bit about, first of all, tell us what drew you into ophthalmology and what prompted you to run for the mayor?
Well, I'm still an ophthalmologist at heart, and I tell a lot of my constituents that, although they elect me to be mayor. And I still have my equipment in storage, so I always thought that if they turned me out of office, I can always go back to doing ophthalmology. Although after 6 years, I know ophthalmology as specialties now are on the cutting edge. It would be a lot of retraining right now. But I still have constituents who are also my patients. In fact, as I would campaign, they would say, well, we really want you to stay my ophthalmologist. I haven't been able to find an eye doctor, and I don't know if I'm going to vote for you, rather to keep you in your ophthalmology office. So that was a choice, kind of ironic. But what interested me in ophthalmology was that it was one of the specialties that was people-oriented. I like that aspect of it. I'm a kind of people-oriented person. In addition to the fact that it combined the surgery, but very precise and very cutting-edge surgery. And as the whole field of general ophthalmology, cataract surgery, glaucoma surgery was revolutionized. There's always cutting edge changes that are going on. And that's one of the things that excited me about that field.
Hmm.
I also like the optics. One of the things, we all are multi-layered interests and personalities here. And I've always loved optics. One of the things that I collect are crystal perfume bottles, and just the optics of all that was always very intriguing to me. And so the specialty of the eye involves a lot of optics and the way light plays. And I think there was kind of an inner passion for things associated with that. And so I was drawn to that specialty.
Hmm. For sure. And so it's kind of curious, or interesting why after 30 years, nearly 30 years of practicing, why you would make a decision to run for a political office. Tell us how that happened.
It wasn't as much of a seismic shift as you might think. Um, Although I was trained and practiced as an ophthalmologist, I was always interested in civic affairs. In fact, in undergrad at the University of Chicago, I had a double major, both biology and political science, because for a while I questioned whether I was going to go into medicine or go into law. And actually, I was accepted to both schools. But then the draw to medicine was far more compelling. And that's why I decided that. But um, we are a member of the larger community, a larger humanity. And I was always interested in those kinds of civic call to duty things, and continue to be so. And so even during all the times when I was here uh, during my residency and also practicing, I was also engaged in social responsibly organizations, civic organizations, and kept my eye on the politics of the local community to the extent that we were involved. My husband and I both were involved in a lot of different initiatives and social causes. And during the time when I was still an ophthalmologist, I became interested in supporting the library in the city. The city was going to close its library system because of lack of funding to do that, which I thought was horrendous. And some of my friends decided that we should join together and make sure that that didn't happen in this community because of the effect on literacy and the support for our school system. And
Hmm.
literacy and education were also passions of mine. We have supported that over the time, both my husband and I.
Hmm.
So I ended up being chairman of the library board, and one thing led to the next, and some pastors thought I should be a good mayor, came in and asked me if I would run for mayor, and I said okay, and I was elected, and here I am. So,
The rest is history.
yes.
Uh, well, it's interesting because you said you were interested in, in studying both. You can decide between medicine and law, and here you are. They're converging your two interests right here. So
Uh,
yeah. So kind of talk a little bit about how you made that transition, like as you've said, like from focusing on, healing patients to now healing a community. Talk about that whole transition.
It seemed very far apart, but all the life experiences you can use to build upon other things. So although medicine and politics seem divergent, but in some sense there are some similarities. For example, running a city is a business, and ophthalmology or medical practice is a business as well. So you take that kind of business sense that translates into other situations. In addition to the fact that uh, it's about taking care of people. And I once talked to the graduating class of William Beaumont School of Medicine here in Oakland County. And as I was talking to these graduates from medical school, I said to them, similarly, I know you're interested in how you go from one to the other. And I said, it's still about taking care of people. But instead of taking out cataracts, I'm now fixing potholes. So they thought that was quite funny in terms of comparison. So, but it's not all that dumb. Potholes are one thing. But we're also at the converging edge of how neighborhoods and communities interact, how people interact, how we live, and how we make communities which are livable and sustainable. So those are things that are grander purposes. And if I could give back and have a role in making this place, this world, this Pontiac a little better, then that's a very gratifying feeling too. The same kind of gratification you get when you help people see better, or when you help their health and welfare, and that affects their lives and their families. So in a way, you have that same kind of satisfaction in this role, just different ways. And particularly this year, and this year for an ophthalmologist, 2020, I mean, this is our year. I mean, come on now. So, but 2020, clear vision and all that is our nomenclature in ophthalmology. But who saw this mess coming? We have a pandemic, and so that has affected everybody's life. And that's about health and wellness. What else could be more of a factor in terms of the health of people? And so that has affected us on a local level, because a lot of this has to be decided locally. There wasn't that federal convergence of guidance this time for this particular pandemic. So we're each trying to listen to all the advisories that are coming out from a CDC, from the state government, from the local government, as well as what's happening particularly in our communities, to come up with the policies and procedures that will keep our community safe, and to elicit testing. So, for example, I had to push hard to get testing site here in Pontiac, because for a long time it was less than 1% of Pontiac people have been tested. And that was grievous, given the fact that testing is so important as we're going through the control of this disease. In addition to the fact, we're finding out that there's a certain population, African Americans. There's a sizable portion of African Americans in this community, and I am myself. And early on, we didn't know that how disproportionately African Americans were affected. So knowing the demographics, and one of the things as a member of the African American Mayors Association, which I am in alliance with other mayors associations, we had to push the CDC and our local county to start collecting demographics. They weren't doing that at first, because that affected outcomes, to know how that's been planning, and also in terms of planning and how we did test sites. So there was a lot of medicine that I was able to pull back on to help, and some of the other surrounding communities look to me, because they know I am a physician at heart and in background, and so I was able to do that. In addition to the fact that, as we talk about what happens next, as we're going through this phase waiting for a vaccine to be ready.
Sure.
So one of the things I brought my science to bear is that we will be the first community to get a city app that has contact tracing on it. And we'll be inviting that. So that will be one of the ways we could ease back in to phasing into the on-site business that we've been doing remotely so much now. And we will also be the first community here in Oakland County to get that ready. And so that's also something that aligned the medicine and the technology with my role as the chief officer for my city. So there's a lot of alliance here, and in terms of that. and I'm happy for that medical background, as well as for my continued association and looking at all things ophthalmology and with what my colleagues are doing.
Mhm. Well, that sounds, I mean, that's great, really, all those, so far, all those achievements and everything. And I just wondered, specifically, with since this pandemic hit, like what has been a major leadership challenge in these uncertain times?
Very uncertain times, and we're all building this plane as we fly it, actually, and that has been the art and the science of it all. So having these experiences before uh, partially prepare you for dealing with crisis because that's what we were in. But nobody's around right now who has been through a pandemic before. So this is something we had to approach guardedly and wisely and with some thought and just taking in on every bit of information we could get to make sure we were making good choices.
Hmm.
But on top of this pandemic, there was now this movement, and unfortunately stemmed by a tragic incident in Minneapolis.
Hmm.
And I'm talking about the death of George Floyd. And that was something that just awakened the public to the other things that are going on politically in our country, and called out cries for um, to relook at our social justice system and to look at police reform where it was necessary. And that has turned into an incident in one town, but it's now become repetitive throughout the country. And that was one of the things I think that uh, brought it to such attention and outrage in the population. But in addition, that has sparked now what we see is a movement from all the marches and the protests. And there were all sorts of people coming together, linked arm in arm, saying things must change. It's time for change. And so it was really uplifting to see something that was so tragic has now sparked people to think about how we live better together in communities. And that certainly has affected our community as well as all the communities around it. I'm happy to say that I'm a child of peaceful protest. Came up through the whole Vietnam era and the civil rights era, so I know what peaceful protest can bring and what can change when you have a cause and when you have an idea. So the fact that we see people of all demographics, all ages are coming forward and saying, we too, see that there are needs for change and for reform. And so that's going on. And it's now not only that, but it's sparked uh, enthusiasm around the world. As I see the thousands of people marching in Paris in the Arc de Triomphe. Never heard of George Floyd, would never be in Minneapolis, but yet they too are united in some of the purpose that we see, or what's happening in all the socioeconomic things that need to be revisited in terms of the humanity and the way we should live together and associate together. So long way from ophthalmology, but here we are, and we're each interpreting it that at our own local level for the benefit of our citizens and how we live together in better communities.
Mhm. Well, I mean, let's talk a little bit about that. I mean, with there's many physician associations and leadership groups that, are decrying, systemic racism as a health issue. I
Yes.
mean, why is this so important? And can you expound more upon that?
Well, as a physician, we know that health is one of the chief prizes of human existence. And so we would all tout that as maybe one of the most important things. If you don't have your health, then you're lost from a lot of the other benefits of life. So this has been a health issue because that ties together with the political issues. Because one of the things we found out is that we began to see that the people who were disproportionately affected by the outcomes of this and
Mhm.
were also sometimes the people who also had more limited access to healthcare. So it exposed these gaps in the healthcare, exposed the gaps that we have in communities that where there weren't fresh foods available, where nutrition was at a lower level, where the hospitals weren't as well supplied. The whole issue about getting enough ventilators. There were
Mhm.
some hospitals who had enough supplies and some who were barely able to meet up with all the demand. So all those things we realized that were social economic problems now were visited upon a health crisis. And that's where they were merging, and that's where we saw that underlying the pandemic and the care and the outcomes that came from first care responders and physicians were trying desperately to save lives with a disease they didn't yet understand, were then beset with these other kinds of inherent problems that were decreasing their ability to be able to have great outcomes and to protect the communities health-wise. So it's all linked together. We find that some things are this continuum from care and access to care to how well our community can address health problems. And we see that we needed to strengthen the infrastructure in order to be better ready to save lives.
I mean, these times are just so unprecedented for everyone, and it's just, you know, with on one hand we have this, you know, pandemic that then in itself is a major health issue, and then piled on top of that, you know, we have, you know, the protests and racism, you know, the you know, injustice and, you know, everything that's going on in the country right now. How does one weigh, you know, the challenges of two major health crises at the same time?
Well, you do that, and it can be overwhelming to some. We know that we have to watch over and make sure people who are for a long time sequestered at home, and some of those that has been a mental health challenge. And so you have to take that in regard. So one of the things that, as the mayor, I felt it was important to do was to make sure people had information, because they became more fearful of that, particularly people who weren't as well acquainted with how health issues and crises work. So it was always important to make sure I was communicating with them. So we developed all sorts of new platforms. That's why we got the city app, so we can communicate with people. And I think it's less fearsome if they know what was going on, you know, and granted, we didn't know a lot for a long time, but we were able to convey that, and also convey the fact that this community, I was so proud of the people in this community who stepped up. And so we had groups that were able to supply food for people. A lot of the senior citizens and disabled were troubled about having to go to the grocery store, you know, to get out from where they were sequestered, because they had to be so careful because they were more vulnerable. But we had groups that stepped up, and that was one of the things that we didn't have to worry about, because there were so many groups who were supplying food, delivering groceries, that there was nobody who need go hungry in Pontiac. Okay. And a lot of people were affected. We have a lot of essential workers here who had to go, and then they were beset with childcare. The schools were closed. Those are the things that we were able to communicate. We were able to put a lot of resources together to be able to support people. People who weren't sure whether they're going to be able to have jobs to go back to, because so many businesses had been closed and sequestered. We found a way to get people to support the restaurants that were closed as donors, and pay for meals to help to support the restaurants to give to the first responders. So we had a whole program going called Spirit of Pontiac. So these are things that we built from the ground up very quickly to respond to the need, melding both the need to, you know, support the first responders who were working there, trying to get enough PPE to be able to take care of this onslaught of patients. And so we were grateful to them, and I'm grateful to all the people who heeded the call to say, let's support our community. And that's what I was, kind of the cheerleader and kind of the station master, making sure that the trains ran on time and everybody who needed help, we could reach out to them and support them. So that was very gratifying to be able to support the community at that time of crisis.
And what might be a positive, or maybe several positives, that are coming out of this that would influence how you lead in the future?
Yeah, I think one of the things is that we have seen a community pull together. You know, seen so many people stepped up as had before, but in terms of the other crisis that's going on simultaneously, we have a pandemic of people who are coming out saying, "Hey, look, let's support change." And it's good to see, as coming from a specialty in which there's constant change, that there is also this call for change as people are maybe the self-interest in keeping themselves healthy and keeping themselves alive. There was so much of a initiative out there that people said, hey, in the end, we're in this together. You know, we got to learn to have things that affect us all. And where we thought it was just a local issue, we looked around the world and there are other people saying yes. We found out during this pandemic that there were inequities, and that some people had jobs, and we came out, especially the young people who couldn't even graduate because they had to do that by Zoom. And this is a whole new, brave new world that we're entering. So the fact that there were people who said, look, let's link arms, figure out how we can get through this. And so I was there with some budget and the heating crawl to say, let's find out what we can do, and some cutting edge things. The fact that we found new technology, the fact that we're going to do find quicker ways to get the people to do testing and to be able to give them out the latest health information on a regular basis so that they could do things to protect themselves and their families. So those are the things that we rose to the occasion, I think, and found ways in which we could better yield those services and those healthcare aspects, and hopefully that made a difference.
Mm-hmm. And finally, a question that's near and dear to your heart as an ophthalmologist, with the significance of this being the year 2020, what is your vision for the future?
My vision for the future. So I'm going to talk about that a little bit when I give my State of the City. We do that by the charter every year. And one of the things I campaign with when I campaigned for the first time as a candidate for mayor, I told them that I was the candidate with the clearest vision for the city's future. And so that's what I'm going to tell them. And there has been a lot of change in the last 6 years. You know, Pontiac, when I came on and when I was recruited to run, was going through still the vestiges of that downturn in the economy. It took us a little longer to bounce back because Pontiac was one of those manufacturing cities that was mostly automotive. But we had to diversify our economy, had to bring in a lot of new businesses, and we're doing that now. We're now known as an emerging high-tech hub. We're right in the center of Oakland County, one of the most richest counties in the country. And so we are re-identifying ourselves and changing the narrative about Pontiac. So I'm happy to have done that. And what I'm going to tell people is the vision of the future is the vision of change. We have changed. We're not the Pontiac of old. We're the Pontiac with a different future. And one of the experiences that inspired that particular theme was I was at a funeral and listening to a pastor who was eulogizing the person who had been very prominent at one time in Pontiac politics, and he was talking about that person was an elected official during Pontiac's heydays. And I resented the thought that the heydays were all behind us. And what I'm going to tell people is that no, we are changing. We're catching up with the times. We're having new industry. We have now more new building projects going on than we had since the early days of General Motors in the city. So all that is changed in Pontiac positive, and I'm going to forecast to them that our heydays are not behind us. Our heydays are to come. And so let's do it together. So that's going to be my messaging at the State of the City. And you know, the 2020 theme, well, we didn't quite see all this coming, but we're confronting with today, but we're going to get through it, and to look forward to other times when Pontiac will again be able to say, hey, look, these are great things coming. And if I can be part of that that infrastructure to begin that happening and bringing people in to have an inclusive kind of involvement with the change in the government in Pontiac, then I will have.
Right. Well, I mean, thank you so much. I mean, it's just really wonderful to hear the accomplishments and how everybody's doing in Pontiac, and we really wish you the best of success.
It's wonderful to talk to you. Say hi to all my colleagues, and maybe someday I'll be able to get back and use an ophthalmoscope again. Okay. All right.
All right. Thank you so much.
It's a pleasure talking to you, and thank you for the invitation.
Thank you, Doctor and Mayor.
All right. Look forward to talking to you. Bye now.
Okay, bye-bye. Thanks again to Doctor and Mayor Deirdre Waterman, for her time and best wishes for continued success. Until next time, stay connected to Ophthalmology Times by going to ophthalmologytimes.com, subscribing to our newsletter, and following us on Twitter, Facebook, or Instagram. We'll see you next time.